Today, my cursor is going to be pink, so here it is in that left corner. So let's just start. So here we start with air coming into the nares. As you can see, you have anterior nares. This blue line then represents that turbinate flow as it's circling inside of those meatuses. And so, as you can see, you have superior, middle, and then an inferior meatus. It goes through the middle concha, and then eventually it makes its way through this nasopharynx and then downward into the oropharynx. So this essentially becomes a funnel. This is why when you get sick and these turbinates are stuffed up and you start mouth breathing through this pathway, you have non-conditioned air and you start to actually develop a sore throat. So as you can see, this is a progression of what Kathy likes to, this entire system over here, starting with rhinitis all the way ending with encephalitis. So these are just different pathways that you begin to expose your mucous membranes to infection, leading to swelling, inflammation, obviously, because itis, as we know, is the suffix. So, obviously, this is cut from a mid-sagittal view of the head. And so that's what we're doing to our head. If you can recall, Dan is bisecting our head. So we are going to see this basically as it is here. You're going to still see these olfactory epithelium with your bulb, perhaps. So we'll be looking for that. But in reality, is it going to be as clear cut? Absolutely not, because there's so much tissue covering all of this. So in a little bit, we'll scroll down and you'll be able to see. Something else I want to point out is your eustachian tube to the middle ear will also have an opening that comes into your nasopharynx. And so obviously, if kids stuff shit in their nose all the time, they might get air through this nasopharynx, oropharynx area, but also sometimes food can come through here. And we'll talk a little bit more about this particular opening and how it is known as the fauces. Something else I want to point out is these two bundles of green here. That is actually your um, tonsils. So we have two sets in a adult. We have our palatine tonsils, which are down here, and then we'll have our pharyngeal tonsils up here. Those may not be completely intact or even there anymore for our patient population in the adult, especially on people that we're dissecting. So we'll see if he has those. Pretty rare for him to still have them. Sometimes they get taken out. Um, what else? So as we're scrolling down, these are basically the things that we're going to look for first. The hard palate with the maxilla and the palatine bone, and then we'll also be looking for the roof of the nasal cavity, which is your cribriform plate. So here is what it looks like from the front side. We just left the mid-sagittal, and here you see your different inlets. Your maxilla is here, your ethmoid bone with all of its shelves inside the eye socket here. So as we're scrolling down, you'll start to see a little bit more of those prominent structures that are circled here in red. Um, this again is the perpendicular plate of the ethmoid bone. This will come back time to time. Now, when we are cutting mid-sagittally down the head, as we had Dan do, we may not have this plate intact any longer. So I'll be curious tomorrow when we go in to see if it is indeed intact. These are your different cavities. And so like we were talking, your sinuses will get stuffed up if you start to get those infections. But recognize within your ethmoid, this very unique bone has a lot of sinuses. And so it is a pretty interesting bone to see once you guys get into it. Another view of the sinuses here. This is cut from sort of a coronal suture. It's not completely midway through the head, but you can see how large our tongue really is. And this area here is our fauces. We'll talk about it more later, but of course, your other sinuses here, your maxillary sinus. This, what do you guys think that is? That is the inferior meatus, the inferior concha. And so here's the middle, here's superior. Recognize that once we cut them down, the only one we'll really see is the IC, mostly from the frontal view. From the side, it's not as clear cut, and you will not see that little twirling action that you do here. Something else to note is we probably, in our view, will not see the perpendicular plate of the ethmoid again because we're cutting straight down the head here. Here's the ethmoid bone with all of our air cells. So you can always tell which one is the ethmoid here. Again, another image, very helpful for us to have some radiographs of this to see the sinuses. And you'll see a lot of ENT views from this particular coronal view here. Some other sinuses that we might see once we're pulling away those concha is this one right here. That is the sphenoid sinus. It is what I look for when I'm looking for this little guy. So you guys be thinking of what you think this little thing is, and we'll talk about it in lab. Again, this is your maxilla. More bones here. So in this section, they're taking out this um, spiny part of the zygomatic process here. So once it's taken out, what you'll actually see is back here. Why is this important? So this is actually part of your sphenoid bone. Um, there's a fissure that Kathy talks about a lot, and this basically has different plates, and you'll see this comes in a little bit more when we're talking about pterygo muscles, which are part of your mastication, part of your four muscles of mastication, which we already covered two of them. What do you guys think that is? One of them came right here, and one of them came right there. So I'm hoping that you said the temporalis muscle, which we scraped down so that we could cut. And I'm hoping down here what's on the mandible. So I'm hoping you said masseter. Okay, here's another great image of the perpendicular plate of the ethmoid bone. Again, we may not see that. Here, the tissue is rolled away. You'll see there's your inferior. These two are a lot harder to see on a real person, but those are your superior and middle nasal concha. Here's your sphenoid sinus and something that sits inside that little thing, that little dip. Here is it from the inferior view looking up. So here is your I'm sorry, maxilla, because this is the upper row of teeth. This is the processes where your jaw would go into. This is your hard palate back here. Again, it's labeled conoe. This is an opening. Um, we'll talk a little bit more about that and how it is in relation to the mid-sagittal cut. This is the greater wing of your sphenoid bone. We'll talk about that a little bit more once we get down here. So the greater wing, the lesser wing, both here of the sphenoid. These are important when we're talking about our cranial nerves because certain ones come out of this greater wing. You guys will all learn that once you're in grad school, but for our purposes, not necessarily something we need to cover right now. There's another great view. Um, All of these are actually what comes out of it. So in case you're curious, take a read, pause through this and read what comes out. And realize that when I'm saying here trigeminal, that's just shortened for 5. Here we go. So when we are opening up our guy, he will look just like this, except a little less clean because this has already been touched up. But this is the perpendicular plate of the ethmoid. This is going to be your maxilla, and you can tell this is bone here, just like this is bone. Here is your soft palate. So this is kind of hard palate going into soft palate. This little guy that dangles in the back of your throat is what? I'm hoping you said uvula, and as we are going down, this is completely oropharynx, this tube down here. So now we'll talk about this area, the nasopharynx. This has the eustachian tube opening. So when you are yawning and your ears open up, this area here is what's getting stretched. And that is near where all the muscles that we are going to be looking for will be located. You also have a lot of nerve involvement. So here you have cranial nerve 1, olfactory. Then you have a ganglion, so a grouping of them right there. They are going to be your preganglionic parasympathetic fibers. That's from cranial nerve 7. And remember, cranial nerve 7 is a GVE function as well. That is why it's able to provide secretions. So you'll have also eye involvement, lacrimal involvement, as well as saliva. Another great view here. You can see that we're simulating food going down with this little blue circle. This, the conoe, this is where it comes out of. So you remember those two little openings with the bones. Obviously, you can only see one side here. So remember, in most pictures, conoe looked like this from above. All right, and then here again is another nice one. You can see the tongue is huge. This down here is part of your mandible. You've got 2 teeth, uppers and lowers with your normal bite. This is your epiglottis. This is the opening to your larynx. Here's the tracheal rings, right? So let's talk about those muscles. So here are the pterygoid muscles. Earlier when we were talking about taking away this zygomatic process. These are part of our muscles that are also involved with mastication. So we sort of did this, not exactly, but we basically skinned, we took away some muscles, we pulled down our temporalis here, we cut at this away, so we were practicing our intubations. And then here are those two other mastication muscles, the lateral and medial pterygoids. All right, so here again is a great review of what we are looking for, this entire thing. So what I look for is I find bone here, the hard and soft palate. This is your uvula, and then we need these muscles here. So the two muscles that Kathy was talking about, the Valatini brothers are the Veli Palatini brothers in reality. So it's tensor and levator. Tensor will go up and down. Levator will travel a little bit like this. What they do is they lift this area of the nasopharynx upward and bring this palate upward as well. They're very, very small, very delicate. So we will be looking for those and these guys here. So we're basically looking for a variety of small muscles within this tiny nasopharyngeal and oropharyngeal passage. So first up, we have the fauces, which is this dark space where the food travels down. The two muscles that we're looking at right now will be cut mid-sagittally, so we're finding them bilaterally on each side. And how do we do that? They're basically curves that go downward. So the first one is the palatoglossal, it's on the outside. Then we have this inner one, the palatopharyngeal. So we'll be looking for both of them. This area right here, we might even find our cranial nerve 9 coming out of the jugular foramen to innervate those areas. This is a very important screening we use today. It's called the Malampati scoring system, and it is used to assess for basically difficulty with laryngeal intubation. So if somebody's tongue is huge, I'm going to expect, okay. They opened their mouth, they said, and I don't see any fauces. So I'm going to expect, okay, I need to whip out everything that could help me with this intubation because my blade still needs to go into that fauces. And you guys have done practice once on our cadaver before, so you understand the blade has to fit inside here to pull everything upward and front so that we can put our tube down. So up next we have this one here. This is basically a continuation of what we were just talking about, except for now we're looking at our other muscle groups. So here's again the fauces. Here's again those tonsils that we may find, the conoe. This is kind of a very uh, busy picture, obviously, but we can do, here's a duplicate of it so we can. So these two muscles here, those are those are the tensor veli palatini and levator palatini. So as you can see, they do both kind of go in the same direction, and that's why it's a little bit hard every time to distinguish each one. In a donor, usually I can tell because one of them kind of goes like that a little more, and one of them kind of goes upward a little more. So hopefully on our guy, he is also this way. So we're looking for those two. We're looking for these that form the pillar of the fauces. So here you can see it. Let's erase that. We'll erase salpingo. So here's the other one we're looking for. This guy right there is the palatoglossus, palatopharyngeus. So imagine you're coming from the palate, from the tongue. So that makes sense, right? Tongue to palate. Now this is palate to pharyngeus. So palate to pharyngeus. Makes sense? So it would actually make this angle. This was very confusing for a lot of us because when we see it from this angle, that's all we know how to do it. Arches and arches. From the side, that's what you have to think about. Where does it go? Where is it coming from? And that's very helpful here. Okay. Something else that we're also looking for is this guy. So because we know that these two muscles are helped, well, they help in yawning and swallowing, that's what we usually will look for. The last thing that I also like to look for, which Kathy thinks is going to be very difficult for the first years, because even in my cohort, I was the only one that found it, is this salpingopharyngeus muscle. It's coming from this eustachian tube down to the pharyngeus here. So we will look for ours tirelessly because I think we can do it. Another great view. This is the retropharyngeal space. This is very important. This is the back of our pharynx so that we can see certain muscles. So as you can see, we take out all of this, and on ours, I think it'll be extra um, helpful because after we get past our spinal cord, we would get to this. So that'll be very interesting because we've never seen this view in quite this way in a donor. So. All right, so this is the back of the pharynx. You've got so many nerve outputs around here. So first off, we have cranial nerve 11, which is your accessory spinal nerve coming down to your traps and your SCM. You've also got some cranial nerve 9 involvement because it does do some GSE to your pharyngeal muscles, and we'll talk a little bit more about your pharyngeal muscles in a second. And then through your internal jugular opening here, you also have cranial nerve 10 coming down as well. So we already talked about these two, but vagus also comes down to join. Then your sympathetic chain has some presence here. So this is our superior cervical ganglion, or SCG. We'll find it on this side. It's long, it's a lot harder. So that'll be something that we are also looking for. All right, so these are your pharyngeal muscles. You have three groupings of them: superior constrictor, middle constrictor, inferior constrictor, and then just straight up esophagus. They all have bilateral parts, one that comes from the right and then the left, and then they all meet in the middle to form something called the pharyngeal raphe. So down here, again, they're basically, Kathy calls them like pots. Three little pots. Imagine they're all sitting inside of one another. And as they constrict, this passage shortens. So you can see they all come into each other. Imagine if this was constricting into itself. They do all have little offshoots of muscles. So right here we have our styloid process. And that is where stylopharyngeus goes. And remember, it comes in right here at that station. Or I'm sorry, not the station. That is salpingopharyngeus. This is still stylopharyngeus. So the other thing we'll think about is that cranial nerve 9 pierces this. That should, I know that says 4, but that should say 9. So it goes through this muscle and we should be able to see it. Here again is a little breakdown. So we're going to find our palatopharyngeus salpingo from the ear and stylo. Palatopharyngeus will already be found when we're doing the side because we're doing palatopharyngeus and our other pharyngeus muscle, palatoglossal. So here's a view if we cut it right down the side and then took it downward so that we could see the front side anterior, but we took away the posterior. So here's the nose with the septum and your anca there. Here's the tip of your larynx. You'd have some IJ, internal jugular, coming down the side. And here's the piriform recess where we will find your internal laryngeal nerve, which comes from cranial nerves 9 and 10. Another view of those muscles that we're going to get. This one is a great one. Great freaking picture. So you can see a little bit of everything here. beautiful separation of your different constrictor muscles. You've got your vagus nerve coming down here. Here's your right recurrent laryngeal, which loops back upward. And here you can see another view from the side of where your constrictor muscles will end up. So here, pterygoid coming in again and again. Middle constrictor coming onto hyoid, and inferior constrictor coming onto your thyroid and cricoid cartilage there. This is a really neat picture as well. So you're separating at the raphe. Great picture of stylopharyngeus. And here is these cut away and reflected. This is also a great picture. So here's your piriform recess. Kathy calls it the gutter. This is where we'll find our laryngeal nerve here. Another good picture. Uh, let's see, it's not quite there yet. We already kind of talked about this. We went and looked at our model. We know that there are different cartilages here. So we have the arytenoid cartilage up in there. We talked about that, and we talked about the muscles that turn them. Another great view, the facet of the cricothyroid ring. Wonderful image there. And you can see on a real person, all of those little cartilages, they're just little bumps. It's a really good chart here that tells you about everything and what it does. Another great image. So here we have the vagus coming down. It's dropping a branch of itself and coming back up. This is your recurrent laryngeal nerve. This is one that I said if you're getting a thyroid surgery, since your thyroid sits right there, you could injure this and cause them to lose their speech. Here's that internal laryngeal branch, the external laryngeal branch, and superior laryngeal branch. This is just talking about GSEs and all those here. Here is a wonderful image of your internal laryngeal nerve inside that gutter. So that's what we're going to be looking for. Very delicate, as you can see. So we're going to be very careful. And that is it, guys. I'm going to give a very abridged version of this in our meeting at 9. Otherwise, if you have any questions, please let me know, and I'll see y'all soon. Bye.